Okay. So the schedule for this week today, we got 4 hours. Tomorrow we have a lecture. Wednesday's lecture's canceled. So Wednesday, don't worry about it. You're done at 2:30 whenever you guys are done on Wednesday. So we'll be able to finish up GI tomorrow. Next week, we have review and then your exams next Friday for GI and renal in a week, well, a week and a half, 2 weeks. So next Friday will be your physio exam. So we have to just finish up this last little bit, guys, last little bit of renal. How do we control our bladder? So micturition is the medical term for urination. We have what's called a guarding reflex, and that prevents that involuntary emptying of the bladder. So we know when our bladder starts to get full. We have stretch receptors. We mentioned stretch receptors in the very, very beginning lecture of this class, of different ways we can have receptors being worked. Remember, we have mechanically gated channels. When the stretch of that muscle or that tissue occurs, pulls apart the receptors, allowing stuff to move. Similar here, as our bladder starts to stretch, more and more impulses go to the brain. Says, oh, our bladder's starting to get full, you may want to go to the bathroom. And then if you keep waiting, the bladder fills up more and more and more stretch, and they get to the point where you can't hold it anymore and you really got to go to the bathroom. So there's a bunch of afferents and efferents that are involved. We have to deal with parasympathetic and sympathetic, but we also have to deal with skeletal as well, voluntary muscle. Remember, we can control urination and defecation through external sphincters, which we'll talk about in a second. So we'll get to the pictures as we go through, so don't worry about the picture right now. So this is talking about those stretch receptors. This is the volume of volume of urine in milliliters in the bladder. And we have these intravesical pressures. So obviously as the volume of the bladder starts to build up, we get these micturition contractions. And you see as we start going up, more and more volume, those contractions happen more frequently. And they're going to send signals to the brain in the micturition center in the pons. Remember, all those higher functions occur in the pons. And it'll tell you, hey, you better start thinking about going to the bathroom pretty soon because your bladder's getting pretty full. And micturition center in the pons. In the medulla is where it occurs. In order to get urine to flow, we have to inhibit the sympathetic system. The sympathetic system has an effect at the internal urethral sphincter. And when you inhibit the sympathetic system, remember the sympathetic system is that constriction of that urinary sphincter. So when you have to go to the bathroom, the sympathetic system needs to relax so that sphincter can relax and allow urine to flow. So that's the one thing the sympathetic system has to do. So think of it that way. You have to inhibit the sympathetic system to open that internal sphincter. So we're not stimulating our sympathetic system, we're inhibiting it. Everyone understand that? Remember, go back to fight or flight, rest and digest. We don't want to have to stop and pee, so we have these sympathetic system clamp down on those sphincters so we don't lose function. But when you have to go, we have to inhibit it so that urine can flow. We also have parasympathetic innervation, and that's through S2 and S4. And they cause the detrusor muscle to contract. The detrusor muscle is the actual bladder muscle itself. It's called the detrusor muscle. So if we're squeezing the bladder, we're contracting it, all the urine only has one direction it can go. Out the urethra and out. So by having parasympathetic stimulation, causes the detrusor muscle, the bladder itself, to contract, pushing urine out. And because we are parasympathetic, acetylcholine to your muscarinic receptors. So let's look at this picture now. We have our micturition center in the pons. Okay. Here is our parasympathetic innervation through S2, S4. And you can see here has two effects, bladder and the internal sphincter as well. So the parasympathetic controls the detrusor muscle, and it also has input into the internal sphincter. The internal sphincter is also under control through the hypogastric nerve, your sympathetic innervation. So your internal sphincter has two innervations, sympathetic and parasympathetic, to control that internal sphincter. Here are your visceral afferents, which again are sending the signals to the brain, to the pons, to give you status on your bladder and how full it is. So that's your afferents going to the brain, and the efferents through the pelvic nerve and your hypogastric nerve control your internal sphincter. The external sphincter is under somatic or voluntary control, and that's with the pudendal nerve. But this is voluntary. So when you got to go to the bathroom really bad and you're squeezing to not let go of anything, you're really constricting hard on that external sphincter. That's under voluntary control. So when anyone comes in with lower back pain, they hurt their back, one of the questions you always want to ask them is, do you have any bladder or bowel incontinence? Did you hurt your back so much that you hurt this pudendal nerve? And now you can't control your bladder or your bowel functions, because that's the nerve that is provided by your voluntary muscle. So sometimes people get back pain, they fall off a ladder, they hurt themselves. Always ask them, do you have any bladder or bowel incontinence? If they say no, then you know this pudendal nerve is still intact and they can still control their functions. It's when that nerve gets damaged, then they can't control it anymore, because you can't control that external sphincter, and everything just goes. So that's kind of the innervation. Here's looking at a more direct way with regards to actual receptors now. We have our parasympathetic nerve, ACH, onto a muscarinic receptor in the bladder. We have our sympathetic nerve as well, and this also goes to the internal sphincter. That's an alpha receptor. So when you guys are studying these alphas and betas, when you start learning them more, when we say like beta 1's in the heart, beta 2's in the lungs, you have betas in all your tissues. It's just that you mainly have beta 1 receptors in the heart. You have beta 2 receptors in the lungs. There's also beta 3, but they could be anywhere. Same thing with alpha 1 and alpha 2. Certain tissues have more predominant for one side, alphas or alpha 1 or alpha 2. But as you start learning about more receptors, you'll see about alpha 1, alpha 2, and where they are. So this is an alpha 1 receptor. And then lastly, again, our pudendal nerve, so it's somatic, and that controls our external sphincter. Okay, so again, you feel the need to urinate, you can control the external sphincter, the internal one is under sympathetic and parasympathetic control. Everything just repeats itself. Okay, so a summary slide, again, your sphincters, internal urethral, smooth muscle, involuntary, therefore parasympathetic and sympathetic. And then your external is somatic, skeletal muscle, voluntary, it's your pudendal. So make sure you know the nerves that control how you pee. That's really it as far as the renal section. We're done now. Any questions about micturition? Okay. Let's go to GI now, and let's stop.